Hello, friends. Greetings from your mentor, Sidra this side. Is my voice audible and clear to all of you out there? Hi, can you all hear me? Hello, Aisha. Hi, Anusha. Hi, Archana. Hi, Banu. Hi, Divya. Hello, Lean. Hi,
Hi, Dr.
Maliha.
Yes,
Sidra.
ma'am.
Thank you very much. Lots of familiar names, and I'm so happy to have you all
Yeah, we
here.
can hear you well.
Thank you very much. Thank you. Warm welcome from the entire team of RFA Tutors, the reliable future ambition. Thank you very much for joining in. Thank you, Meenakshi. Thank you, Nasreen. Thank you, Jayanti. Thank you very much, Kazi. Lovely seeing you all here. Thank you very much. Friends, it is said that success is the milestone that is achieved after struggles, the perseverance. It is a vision, it's a goal and commitment of furthering your aspirations and the way you set your direction. Now, success definitely demands hard work and patience, and it's not granted overnight. We do not have any shortcut to success. This is what I always say. And by taking baby steps, we will make it happen. Today, we are going to take this oath that no matter how difficult it would be, no matter how much hardships we are going to face, we would make it happen together like people who had been doing it earlier. You are going to be the one who is going to make it happen in January 2022. So am I getting a thumbs up from all of you out there? Am I getting this oath from all of you out there that being hands in hands, we are going to make it happen? Where
Yes,
are
ma'am.
my... Thank you very much. That's like my students. Thank you, Aisha. Thank you very much, Shweta. Thank you, Sunita. Thank you, Gujar. You all have to make it happen. We, like a family, are going to start from tomorrow. Hands in hands, you're going to find me 24/7 besides you, and you will see the improvement day by day. People who have done it earlier, I managed to pass all my exams in one go. We are not superhumans. You are just like others. The only thing is that it requires targeted preparation. For that, I'm here today to tell you that it had to be focused from day one. So agenda for today is that I had to prepare for MRCOG Part 2. Why students, they can't make it, why they happen to fail, how to make it in one go. We are going to stress upon that because from tomorrow, you're going to start your preparation for January 2022 with me. So you all should be knowing that what is going to be those type of students who are going to make it happen in one go. All right, so people have been perfectly preparing before you guys. It's been around 3 to 4 years. They had been studying hard, and today they're working as MRCOG in different parts of the world. My shining stars, a few examples of hardworking students. They'll tell you that how they can retain this information, how they used to work with the hospital, with their domestic chores, with all the commitments. They manage the hard work of the MRCOG too. I've got Javeria here from United Arab Emirates. Hi, Javeria Samro. How are you doing, my dear? Hi, Javeria.
Assalamu alaikum, ma'am. Good evening.
Walaikum
everyone.
assalam. Thank you very much. Thank you very much for joining in, my dear. How MRCOG2 can be easy. Your friends would like to listen to from your side. How the studies can be organized, Javeria.
Actually, ma'am, first of all, I used to emphasize in the school that read all the material, that is GTGs, talks, nice guidelines, and all the SIPs, whatever the authentic material is. Read only with a fresh mind, and along with reading, we need to make our notes, especially following the tables and the charts, charts, and all these. So, along with that, we need to practice questions. Whenever we are tired, not if we are having a fresh mind along with the household work and all the domestic things and with the families, with the hospital work and all these. So whatever I used to do, I used to only do with a fresh mind, reading with a fresh mind only, and only then it takes first time reading takes a lot of time along with making notes, but after that when we'll be able to do this notes and first time reading thoroughly. And after finishing this first read, I found my notes that they were very concise. That it only took me 15 to 20 minutes to go through a guideline or
Perfect. Yes,
and along
100%
with the
agree.
guideline, yes, after following your schedule, ma'am, along with the guideline, only there, I used to read the talks also with the relevant topics, and I just need to add on the topics or some points over in that guideline. So it would make a topic really, very easy.
Yeah, definitely. Yes. Today I'm going to emphasize on that as well. Yes, Javeria. Thank you very much for all the guidance to the students. Yeah.
And yes, ma'am. And other thing is that from the very start, I have been writing down the bullet points like vitamin D dosages, folic acid 5 mg dosages, and other specific recommendations.
Yeah.
Some important risk factors for some diseases like SGA, preeclampsia, diabetes,
Mhm.
GDM, and some percentages for make a separate portion. You should make a separate portion for these specific things that will be easy in the end to revise. Specifically in the last few days, 2 weeks, I used only to get my notes and on these things, and along with the recalls, I did only that.
Correct. Yeah. Okay. So students are going to start from the first day of the schedule. So what would you like to advise them?
Then right from the start, reading the guidelines, all the materials. Along with them, you need to have a fresh mind. In that, you have to have a full sleep, at least 8 to 10 hours, have a, a good diet, balanced diet, and then along with that, exercise also is necessary, very much. At least 15 to 20 minutes walk is really very necessary to throws off your stress, because at the end, it sometimes it happens that you do not get enough sleep and you're very, really very hard, tired, and
Retention
you're
is
hard
less.
to,
Yeah.
yeah,
Mm.
you are
Yeah.
hard to get sleep. Even this happens with me, that if I'm exhausted too much, then I'm unable to sleep. For that, their exercise plays its role for me, at least, that I used to get a 15 to 20 minutes walk or brisk walk. So you
Yeah.
need to eat with a fresh mind only.
True. Correct. Yes. Okay. Thank
So
you very much, Varia. Thank you very much. So the students are definitely going to be benefited from your advices, my dear. Ashwarya, where are you? I know you were in train a while ago. Just wanted to take you online. Hi, Ashwarya. How are you doing? Sidra, I'm waiting for you.
Hi, ma'am. How are you?
Hi, I'm fine. How are you doing?
All good. Thank you so much,
Yeah,
ma'am.
thank you. What about the teaching? What about the experience? What would you like to say?
Definitely a lot, ma'am. The time won't be enough to tell that, but I'll definitely like to emphasize few points to tell everybody that the course planned by you, ma'am, was so well planned that it
Mm-hmm.
not just includes the studying for the first time, but gives enough time to make notes, then to have not even just one revision, two, and even the third revision.
Yeah.
Initially, when I joined with you, and you told me that time also I was quite suspicious or confused on myself whether this is possible or not. But yes, I really trusted you, and I found out in the end it was actually possible because
Yes.
the whole course was concise in so well planned notes that it was so easy to revise
Thank you very
the
much.
first
Thank
time, second
you.
time, and even the third time. The each
That's the
session,
benefit. Yes,
yeah,
yes, yes.
the each session is so well organized, ma'am, that it's like each and every minute was worth attending of that.
I'm really
You just
grateful.
made the concept so crystal clear, and you even discussed. There were so many conflicting points between various GTG, NICE, and TOG articles, and you so well discussed that it became so clear. There was no confusion at all.
Yeah.
And more importantly, as Javeria has also told, that there were certain volatile points in the course, which you made so easy for us by putting them in the form of tables and flowcharts, giving us trick not just to memorize, but also to remember in the form of we all love your gift slides. Everybody
Oh,
knows you're
thank you.
famous for that, and
Yeah,
even for
all
the treasure
updated,
folder.
all new gift slides would be coming ahead. Thank you very much, Ashwarya. Students would definitely follow. I just wanted to give them
Yeah.
example that it's doable. People can do it. It just requires an organized study plan, my dear. Thank you very much for taking out time.
Ma'am, if
Thank
you
you for,
don't mind, I just want to add one more point
yeah,
because
sure,
I
please.
want
Yeah.
to tell everybody that there were a lot of weak topics for me, like Eurogyne, the labor module, the cancer module. They actually became my strengths in the end. I realized that what I was scared of were actually my strengths in the end, and all thanks to you, ma'am.
Oh, thank you
Seriously
very
for
much.
that.
Thank you. No, I'm really grateful. Thank you very much, friends. Thank you, Ashwarya.
Thank
Thank you,
you.
Javeria. This was
Thank
Javeria
you
from
so much.
United Arab Emirates, friends. And this was Ashwarya from United Kingdom. Thank you very much for being here. I love you all my students. Thank you very much for the support and joining in. Thank you, my dear. All right, friends, let's come to the agenda today. So for all those who are beginning, thank you very much. Love you more, Javeria. Thank you. Everyone, please go on the mute mode so that we can discuss the topics. Thank you. All right. Okay, so coming back to the agenda today, there are beginners in the chat today as well, the ones who have joined here, who are waiting for the results, who have taken their MRCOG-1, and they want to begin early. The first thing which I would like to tell you is that MRCOG Part 2 is entirely different from MRCOG Part 1. When you compare its study with MRCOG 1, like one of my students, she called me from UK day before yesterday, and she was like, Sidra ma'am, I did my MRCOG 1 in 20 days preparation. I was not surprised. I said, yes, it's doable in 20 days. Why? Because MRCOG 1 is a lesser amount of curriculum. That's number one. Number two, the repeated questions are more. And number three, it's the first exam to enter into the MRCOG. So the passing is higher as compared to MRCOG 2. Yeah. So as compared to MRCOG 1, MRCOG Part 2, it can be done, but it requires a little more focused hard work. So don't compare your study to MRCOG 1 because MRCOG 2 curriculum is a little bigger. And also we need to put in more effort and hard work because there are things which are less important. There are things which are more important. And the problem with students they face is that they keep everything at the same level. For example, if you keep the GTG, the TOGs, or for that matter, scientific impact papers in one line, you are wrong. We need to give more importance to those things which are coming more in exam. Are you all with me on this? Hi, Koshri. Hello, Farzana. Are you people getting that, Archana? The things which are more important, definitely, yes, we need to give more time to it. Otherwise, we are wrong in our preparation technique. All right. Okay. So we've got modules. We have got modules from teaching, appraisal, and assessment. And I bet that you will have all the strength in teaching, appraisal, and assessment with all my updated data. The clinical skills, the maternal medicine, the core surgical skills, the post-operative care, the surgical procedures, the antenatal care, the information technology, the clinical governance, the research. We've got the gynecological oncology, the urogynecology, the postpartum problems, the gynecological problems, the subfertility, the sexual and reproductive health. We've got early pregnancy, the management of labor, and the management of delivery. Hello, Anam. Thank you very much for joining in, and thank you for lovely heart emojis. Okay. So these modules, they're important. Why? Because they tend to give a distribution from this. Right? We should be knowing that by doing one module, okay, we are doing at least 10 questions, maybe single best answers, maybe extended match questions. So module-wise study is very important. I'm sure you've been through my ABC of MRCOG Part 2, but I would like to tell all of you is that being organized from day one is very important as we are starting gynecology from tomorrow. So you should be knowing that gynecology, all the topics, including the Green Top guidelines, including the NICE guidelines, including the TOG articles, including these scientific impact papers, and all these would go side by side in your preparation. That's number one, you should be knowing that what modules we need to cover. The second thing important is that you should be knowing the pattern of the exam, because knowing the pattern of the exam makes you go towards the right direction. It is single best answers and it is extended match question. From day one, my requirement from all my students is that it should be extended match questions we are going to put stress more upon. Because for the last experience of 3 to 4 years, what I've seen is that students, they generally tend to fail in extended match question. They tend to face difficulty in extended match question. It's not that single best answers are super easy, but yes, compared to the extended match questions, single best answers, they are easy. And we are going to distribute each after the module is over. You're going to do your assessment, and I'm going to be strict in checking your scores as well. Because if your score is less in the mock, so that's not your failure. Basically, it's my failure that somewhere you people are lacking. Somewhere the concept needs to be better. Somewhere we need to sit together and see that where the things are wrong. And we need to sort it out, okay? So after every module, we are going to do that, stressing upon the extended match questions more. All right? Thank you very much, Shweta. All right. Okay. Now, coming to the first part, that is the Green Top guideline. There's a long list, which I've already given in the ABC, so I'm not going to repeat it today because the bombardment of the topics that makes you go scared. Oh my God, we can't do this topic. And my moderator was telling me yesterday, Sidra ma'am, please don't scare them in the introduction. They should be knowing that, yes, we are going to do it with you, and they should have a strength. Am I right, Safa? Yeah. So I told her I would not be making them scared, but giving them all the confidence that, yes, we can do all the curriculum together and we would make it happen. So the first and the foremost important thing of the preparation is 90% of preparation is with Green Top Guidelines. What is Sidra ma'am's requirement from you guys? The Green Top Guideline, the first thing you're going to do is going to read it first, right? The first read of the Green Top Guideline, you're going to do yourself, keeping in mind that you have to make notes, right? You have to make notes. Making notes is a 3-step procedure. When I say it's a 3-step procedure, this is what I used to do in my preparation, and I always coach my students the same. The first thing is that you're reading your notes, right? You are reading a Green Top Guideline. For example, tomorrow you have to start with premenstrual syndrome, right? All my core students, please. You have to start with the premenstrual syndrome tomorrow, okay? So you will read the PMS guideline and you will put the recommendations and the bullet points in the notes. This is the first step of notes making. The second step would be that the questions related to that would be posted in the Facebook, and that will be the quiz in the Telegram, right? The questions you do wrong, or the questions which you feel that you did not know the answer, or you're making it incorrect, you're going to write down on the notes. That's step number 2. Step number 3 would be that when you people would be doing the strategy questions, or you people would be doing the exam questions, you people would be highlighting those points which had been touched in the exams or in the older important question. Are you people with me? So at the end of the day, when you people would be doing your 3rd revision, your notes would be complete. Students, they get surprised when I'm taking session and I tell them, go to the page number 230 of mastering and you'll find a question there. And then they get surprised when I say, year 2018, this line, this word came into the exam. And they're like, how in the world do you remember this? It's just because I had been studying like that. It's just because I have been training myself in a way that after doing the recommendations, we are going to make notes in a manner that our notes would be completely highlighted, that we should not go back to the PDF of the guideline again. Yeah, sure, Moshfika Ikfat, I'm going to do that in the end, right? Definitely, yes, I'm going to go to the detail and let you know. Safa is right here. Thank you very much, Safa. Okay, Safa has broken up the surprise of the gift. Okay, thank you very much, Safa, for that. All right. Okay, so after making notes, you should be knowing that you have to revise that. Why are the Green Top Guidelines very important? They are important because this is a protocol of extended match question. It comes from the lines of Green Top Guideline. I'll give you again the example of the guideline which you have to cover tomorrow in the study group, right? So the premenstrual syndrome you're going to do tomorrow, you should be knowing that when the extended match question, it comes as the management algorithm, that what is the first step if she's having psychological problem. And it's a minor sort of PMS. So you choose cognitive behavioral therapy. They ask you that this has been done, it's not effective. So the line of the GTG says that, yes, you have to start with the 10 milligram of SSRIs. So they say that 10 milligram SSRIs have been used. What's the next step? You step forward according to the GTG and you say it's 20 milligram, right? SSRI. So if you're not reading the Green Top Guideline, keen read, it's not there, you're not picking up the points, you are not able to do the extended match question. That is the reason I want you all from day one that lines of GTG should be known to you. Another important point is that not knowing the recommendations, I would not expect any of my students that they do not know the recommendations. And I would be very, very strict on this, okay? But at the same time, the message I receive is, ma'am, I have done this guideline, but somehow there are so many percentages. I always tell them one thing. For the last 2 to 3 years, the trend of the 2 to 3 exams, the trend is a little changed. The percentages questions are not much. Even if there are 10 questions in exam, that does not make you pass or fail, because 5 to 7 percentages, they tend to get repeated from the previous papers. So that's not a problem. So my request and my suggestion to my students is that from day one, the important percentages, put them in a separate notebook. So make a percentage notebook. And out of that, I will tell you that what you have to do and what you have to ignore. Because putting a stress on your neurons for these percentages and forgetting the recommendations, that is not fair in your preparation. Am I able to clarify this point? Am I able to clarify this point? That you put stress on the percentages, you tend to remember, oh, 40%, 50%, 30%, 20%, but you forget that what was the recommendation of the stepwise management. This would not be fair with you and your preparation. So start putting the percentages in a separate notebook, put a label on that, percentages of MRCOG part 2. Okay, so put that in separate notebook, and I will tell you that out of that, what do you have to do and what do you have to ignore. But putting the stress on the percentages and forgetting the recommendations would not be the right thing. Okay, not at all. I would tell you in the live session that what is important. Okay, what are those important percentages which would come and what you need to ignore at all. I expect from all of you that all the recommendations should be on fingertips. There is no excuse that the recommendations of Green Top Guideline, they're not known. The recommendations have to be on tips, and we'll keep on revising. Repeated revision is required so that it is well versed. Now today, when students, they tag me and they say, like, immediately I respond to them and give them the screenshot, because it's line wise, word wise, it's known to me. And that is the reason that you know that what is the recommendation by the college, and that makes your expertise towards solving your extended match question and the single best answer. This was my technique of my preparation, and I would like all of you to do that the same. I used to do that for myself, and I'll give you this tip tomorrow in the study group as well. I'll write a post, and that would be for all my course students that you should be following that, please. What is that? If you're doing PMS tomorrow, right? And day after tomorrow, it is chronic pelvic pain Green Top Guideline. My way was, Hala, that I used to do PMS, like today I've done my premenstrual syndrome Green Top Guideline. Tomorrow, I'm going to do the chronic pelvic pain Green Top Guideline. What would I do? I would give 15 minutes to PMS. Why? Because, of course, this is a human brain. We need to train our brain. We need to learn the things. So in 15 minutes, I would just scan the previous guideline. Reason for that is that yesterday what I learned was it's just going to be brushing up. So what would I do on the third day? I will do the new guideline, and I will give like 10 minutes to PMS and chronic pelvic pain. So tell me, please, honestly tell me, can't we take out 10 minutes a day for the previous guideline which we did? All of you, please, honestly tell me that can't we take just 10 minutes out to revise the older one which we did? We can. It's only that we don't realize that how important it is, right? We can definitely do that. But the problem is that we don't understand, there's nobody to coach us that this is the right way. See, the brain, the Almighty has given the powers to remember everything. It's only that we put our brain in difficulty. We have to make it easy for our brain by making compartments, by making different sections. And if you do it in this way, believe me, you all would be doing it in a perfect manner. You all would be like Sidra ma'am, remembering everything, knowing all the references, and doing it in one go. Am I clear about the Green Top Guideline? My requirement from my students, please. Am I able to clarify this, please? The Green Top Guideline concept is clear for everyone? Making notes, definitely. I'll be coaching you guys sidewise in the study group. Okay. All right. Now, what's the second step? The second step is the NICE guideline. Now, as compared to the Green Top Guideline, it is second in the priority. Nevertheless, it's again important. What's the reason for that? The reason for that is that in Green Top Guideline, we have bold lines in the beginning. We call it as recommendations. I hope you people are aware of the recommendations in the beginning of the Green Top Guideline. Yeah, you all know that, right? Yeah. So after those recommendations, we tend to have paragraphs which we read. But the problem with the NICE guideline is that we don't have the bold points. We don't have the highlighted points. So every word, it's important. Every line, it's important. Specifically, all important NICE guidelines need to be covered. When we talk about the audit research, which is at the end of the NICE guideline, they are least important. Please don't bother yourself to learn those audit and research. It's not for you, basically. It's for the future updating the NICE guideline, the points where more discussion needs to be there, and the points where in future they need to work upon updating the recommendations. So at the end, when audit research is there, you can ignore that. What I would like to tell you is that there are certain things which are not covered by the Green Top guidelines. And what are they? You talk about labor questions. We do not have any Green Top guideline on that. We have to do the NICE interpartum, right? The preterm labor has to be done from here. The subfertility has to be done from NICE. The urogynecology has to be done from NICE. We cannot skip the NICE guideline for these modules. I will make it very easy. I'll make different sections. I'll make stepwise points from there, all updated, because many of the NICE guidelines in the year 2020, 2021, they have been updated as well. So I'm going to do that for you guys. It would be very easy in an organized manner, would try to make your memory better with all the steps that how the question comes in exam. But second in priority, it should be NICE guideline. And if you go to the website as well, you'll find all the updated written summaries as well. All the course students, have you seen that, please? With the page numbers, yeah? Hello? Right. All the course students, anybody here? So did you people go? Yes, Sanita has seen that. That's wonderful. So all updated. Year 2021 guidelines are also there, all updated, and you can only do from there because I have highlighted those points specifically which come in exam. All right. So it's all available on your website. Okay. So now coming to the talks. The third step is the talk article. Now here I have always basically a problem which I see in students when it comes to the obstetrics and gynecologist articles. And what is that? Students, they say, ma'am, I'm not able to do the hyperprolactinemia talk article. I don't have time. So today I've taken out 2 hours and I'm going to do that talk. I said, okay, I understand your concern and understand that you are basically stressed up that hyperprolactinemia talk has not been done. So may I just confirm that you have completed your NICE subfertility? And the answer comes, no, ma'am, I'll do it later. First, I'm worried about hyperprolactinemia. And Sidra ma'am gets angry. I said, no, you have to cover up your NICE subfertility because question from NICE subfertility would be 100%. Hyperprolactinemia may come, may not come in exam, but NICE subfertility would be 100% there in exam. So my first point, which I need to clarify to all of you is that talks are important, but please do not give importance to talk in comparison to the Green Top guideline and the NICE guideline. Am I able to clarify this? Am I able to clarify this point? That's very, very important, please. Yeah, so all of you have to do the talk articles, but they are third in priority. I would definitely do in the live sessions as well. I would do the talk articles related to the HMB along with that. I will do the talk articles related to the hormone replacement therapy along with the menopause NICE, but it is not that we are going to prefer talks and we are going to give more time to talk, which is going to be given to the GGG and NICE. Am I able? The concept is clear, everybody? Yeah, the reason to emphasize today is that I do not want that you start preparing and you people do not have the idea. So today, the meeting reason is that we get an idea that what requires importance. So must to do is last 3 years talk. They are fond of asking questions. It's not only for you guys, all my MRCOG-3 students, they do the part 3 for the part 3 preparation, last 3 years talk as well. Reason for that is because these talks are very important. They tend to give in the OSCE station as well, also in the single best answer. So the topics which are not covered by the Green Top guidelines, like I told you, hyperprolactinemia, we don't have any Green Top guideline for that. We do not have any NICE guideline for that. So all those topics which are not covered by the GTGs and the NICE, definitely yes, no matter they're older than 3 years, we are going to do that. For example, I was just making the first PowerPoint for you guys. So I included the adenomyosis, I included the dysmenorrhea talk article as well, because we don't have anywhere covering up any resource for the adenomyosis. Okay, so older things we are going to cover up with this as well. All right, thank you very much, Hala. Thank you, my dear. Thank you, Sama. So you need to remember that for talk articles, generally the extended match questions, they don't come from this. The single best answers, they tend to come from the talk articles. How they come, it's going to be a pool. I'm going to discuss in the live session as well. I would mark that lines that how they formulate the questions from the talk article. Thank you very much, Noemi. The most important thing I'm going to emphasize again, friends, please lend me your ears. I can see few students busy with the television at the back, few in the kitchen, and few with kids. Sidra needs your attention here, please. They are third in priority. Please don't make this mistake. Don't open up talk articles when your GTG NICE is not done. But definitely, yes. Mir Rafia, you raised your hand, sweetheart. I'm just going to take questions after I finish up, okay? Mir, I'm going to take all the questions, sweetheart, okay? So they are third in priority. So don't give your precious time of GTG and NICE to it. But yes, when GTG NICE is done, definitely we'll open up the talks together and we will do it together. So what is after talks? After talks, we have the Faculty of Sexual and Reproductive Health. So for FSRH, only recommendations and tables are sufficient. Have you people seen the summaries of the FSRH on your portal? Have you people seen all the updated, even the recent implant 2021 I've made for you guys so that all the updated material is with you, right? So it's all with you. And if you just open it up, only that is sufficient because I've gathered up all the exam questions together, right? Okay. No, Bara, I'm going to come to you. Bara, I would tell you that no textbooks are required. What books are required? I'm just going to tell that in a bit. Thank you very much, Noemi. So Faculty of Sexual and Reproductive Health Guidelines, you would just open up your portal and you will do the highlighted points which I've given there because the 2021 guidelines, even the recommendations are all there, and you don't need to go to the big guideline for that, okay? Then we have the British Association for the Sexual Health and HIV. Again, I think 3 days back, you got that on your portal as well. So it's all there. You just need to remember that the summaries are sufficient. Scientific impact papers, we've got mothers and babies reducing risk through audits and confidential inquiries across United Kingdom. We have got clinical governance. We have got consent, which is all available in the summaries. The NHS cervical screening program year 2020, you don't have to do the older one at all, please. The older one is obsolete. The older one, the college has told already back in the mock exams, back in the OSCE as well, that it is not to be done. So for these only, the summaries are sufficient. You need not go into detail. Reason is that it makes only 10%, 10 to 15% of your preparation. So making 10 to 15% of your preparation, that is not suitable that we give days and days to prepare them. Is it justified? Do you people agree with me? That which is 10%, let us give it 10% of our effort. Which is coming 90%, let us give 90% to that thing. Do you people agree? Yeah? So this is how smart students are. So you pick up BASH and you do for like 15 days BASH. And at the end of the day, if there are 3 questions from BASH, you would be saying, oh my God, what did I do? Yeah. So I need to tell you that what is important thing, where you need to put more attention, where you require more revision, and what only requires summaries that if at all some question would be there, we would not be blank in exam. Simple. All right. Thank you very much, Aya. Thank you very much, Safa. Thank you, Susan. Important thing first, and important things need revision as well. All right. Bara has a question here. Bara, sweetheart, you asked that do we need to do textbook? So make it very clear, friends, that no textbook for the MRCOG. When I say textbook means that we have got some sort of gynecological and obstetric books in the market. We need not do that because our source is going to be only the college guidelines. That's it. However, we need to practice the books for the single best answer and the extended match question. So the books which you have to do, they're here: Sir Andrew Sizer's book, Amanda Jones, Janesh Gupta, respected Dr. Mustafa's book, Mastering, Sir Andrew Sizer's old book, The Succeeding. We are going to do Sir Kunje's book. That is Safa's favorite, yeah? And we have the Sir Tahir Mahmood's book. We have got P. Sinha, Extended Match Questions, Gynecology and Extended Match Questions, Obstetrics. We have got Kalevani. We have got Pilkington. We have got Rekha. All these books, Hala, has to be on your tips. And I am very, very strict on practicing of the books because I have learned these books, and believe me, when I was sitting in exam, I could not even think for a single question that this is out of this world. I did not think for a single question. If you want to know the right technique of the books, I'll tell you today. Or do you want me to discuss later? Or the core students want me to do that in the study group, yeah? Okay, I'll tell you what is the right way. What was Sidra's way of doing books, right? You're going to pick up. You're going to pick up, for that matter, Extended Match Question, Gynecology, P. Sinha, right? Today, you have started your book. And because you're starting it from the first day, you're going to be a little slow. Don't be upset. It's pretty understandable that you can be slow when you are making up your pace for practicing the book. So nothing to worry about that. But my only requirement from my students is that please do not do the book while lying on your bed, while watching television, or doing 2 questions, going in the kitchen, cooking something and getting back. Even if you're doing 10 questions, you have to sit on your study table. You have to keep a clock in front of you, and you have to do those 10 questions. After 10 questions, look at the answer of those questions. Whatever questions they went right, you will be happy about that. But the questions which went wrong, take a yellow highlighter. That was my first goal. You put a circle on question number 1. You put a circle on question number 4, which went wrong. So next day, you're doing 10 questions. I'm just starting from 10. It has to be more, okay? In the study group, we'll do more. So next day, you're doing 10 questions. So you'll see the 2 yellow highlighted of yesterday first, and then you'll start doing the next 10. Why? Because that would enhance your memory. So from next day, you had 1 wrong question. So the third day, you will do 3 highlighted from the back questions, and you'll do the next 10. Did you people understand? Once your first go of P. Sinha is done, all questions which are yellow highlighted, you will repeat them in 1 hour, and your first go of P. Sinha would get completed, right? Now, after your complete book's first round is over, you'll open up P. Sinha again for the second round of books. For the second round of books, you'll say that because the first time you had yellow wrong. So second time, if out of those yellow, many are getting right because you've revised them multiple times. So second time, you'll pick up a blue highlighter, for example. So your second go is your blue highlighter. In that go, if you're out of 15, which was in the first go wrong, maybe this time you do 10 wrong and 5 are correct. So those 10 would be blue highlighted. In the third go, you'll pick up pink, maybe 3 go wrong. And just before exam, you'll do only those which were in the third time wrong. You would not imagine, but before my exam, I completed all the books in 12 hours. All books were scanned because I used to keep those points at the back, and I used to revise those pink things which were wrong in my third go. So I did each book 4 to 5 times. Did you people understand? This was my strategy towards studying, and all this way. See, if you're going to do all the books second time, third time, fourth time, it would take again hours and hours to do the book. And today you have not started your preparation, and I give you one question. What is the first line management for HMB as per the NICE? What is the first line management for HMB as per NICE? Please give me the answer. First line management for HMB as per NICE guideline. Myrina. So everybody knows it's Myrina. This question you will find in every book. Intrauterine system, the levonorgestrel intrauterine system. Now, I want you all to be smart. If you do any question first time right in the book, that means what? That means it is on your spinal level. That means that you know that question by heart. So reading it second time and third time and fourth time, that would not make any difference. We have to be smart. We have to revise those questions which we do wrong more. Do people understand the point? That there are some things which are on your spinal level, which you know by your practice, which you know by your clinical experience. So we need to be smart and give more attention to that, which we do not know. And that is the reason that you have to highlight and make your job easy. We are already correcting all the answers of the book in the open group. Mute friends. Mute friends. Okay, some babies here, and he wants to do MRCOG. All right, thank you very much. Okay, so we are already correcting that. Few books are older. I totally understand, my dear. Few books are older, but the question quality is really good. For example, my moderator was discussing with me a few days back that, ma'am, do we need to continue Peace Sinha because I feel that the answers are not right? So I told her the same, but the questions are beautiful. The question formulation is wonderful for the extended match questions. We will correct the answers, no problem. But they should be knowing, they should be practicing those questions. So you all need to practice these books. If the answers would be according to the older recommendation, we'll update that. But at least you'll get an idea that how the questions would be formulated. Am I clear about the book practice, please? The sequence of the book I've already made. I'm going to clarify to you guys in the study group as well that which are more important and from where we need to start first. Okay, so all the books would be done in a sequence. Not to, thank you very much, Naomi. Thank you, my dear. Thank you, Archana, sweetheart. So you all need to remember that strategy is very, very important, because 10 to 15 questions, they're like copy paste, or if they're not copy paste, at least linked to the strategy. Similarly, pass MRCOG is very important. Rubaya, my dear, I'm going to give all these books PDF. So I would tell you the sequence of priority, like the most important, and then after that, in terms of like 1, 2, 3, 4, 5, 6, 7, 8. So there are around 12 to 13 books I want you all to do. What is the problem, Rubaya? The problem is, my dear, that if you read a guideline and you don't practice the books, the problem is that you people do not understand that how the question is formulated. While reading the lines of the guideline, you don't understand. When you do the books, you understand, okay, I read it. So this is how the question comes. So this is going to be very important. I'm definitely going to answer that, Sharnia. Everything would be in the study group, okay? Thank you. So past MRCOG practicing is very important as well, because that gives you a clue that beautiful, wonderful quality questions are there. And this gives you a very clear idea. Okay, so now you people can understand that how moms, they do MRCOG, yeah? Keeping babies in lab, working in the kitchen and studying. So that's what I was telling to you guys, that students, they are in difficult situation, and we women, we need to take care of household, we need to take care of kids, and with that, studying as well. So the student who was having kid, I can understand that how difficult it is, but you will do that. These kids are blessings, and I'm sure you're going to make it happen. Thank you. Yes, Nasreen, thank you very much, my dear. Okay. So after the books, I would like to tell all of you that what is those problem which students they face, and why do they fail in exam? What is the reason of not making it in one go? The problem is that their exam preparation is not in a focused manner. The problem is that they do not know what is important, what is less important, how the question would be formulated. Above all, the problem is that they don't have a good strategy approach towards the exam. They have the stress. They are all times in panic, and that definitely reduces the retention power. They have mindset issues. The biggest problem they face is that whether we would be able to do that. Sidra ma'am, I've got a brilliant friend of mine, but she could not do it in one go. She has failed twice. So I am so scared of picking up the books. This is a shaky mindset. I would like to encourage all of you out there that we have to take a first step. We have to begin the preparation. We have to make a mindset, because if we not take a first step, definitely, yes, we're not going to reach to the success. Again, I would say that you all have to make it happen, a targeted approach, time management from the start. As I told you that I was strict to myself while practicing books, I want my students to be strict to them as well. The more difficult situation you will face during preparation, easier you would feel in the examination hall. You would have your willpower and you're going to resolve that. Please have a focused study. Please do not go into the ocean of the theory part, because again, if you're going to give more time to the less important things and not knowing the recommendations of GTG, that means that you're not doing it great. I would make your groups, I would make your study partners, and I would ensure that each one of you listen to from each other the recommendations. You would make each other learn, because that's the only way. The more you speak, the more you practice, the more you ask the cross questions, the more you're going to have a retention. So we are going to find solution to each problem, but we would make an oath that we'll move forward. We will do MRCOG. It is doable. People had been doing it earlier. Whatever would be the problem, we'll face it together. Whatever would be the problem, we'll find solution to it. And we will work in the right direction from day one. That's tomorrow. Am I clear about this? And are you people agreeing to whatever I'm saying? Would I get this motivation? Would I get this zeal? Would I get this zest from all of you out there? Yes? Nisha, 40 minutes, depending upon the size of the GTG, right? Depending upon the size of GTG. I'm going to take all questions, Geeta, just in a bit, sweetheart. All right, so thank you very much, all those who were asking about the course in the chat box. You wanted to know that how the things would be. There are going to be 28 live sessions, all by me. The session recordings of all the live sessions would be available to you guys. That's going to stay with you guys till your exam date. You people can revise as many times, but definitely, yes, I would ask you to revise again and again. All the important talk summaries, they're there in the form of PDF, a few of my voice records as well, and updated till 2021 July. The recent ones are wonderful talk articles, beautiful topics. I was discussing with my moderators, I was discussing with my students, a wonderful group of recent talks. They're there, and I'm sure they're going to be helpful for you guys here. The Green Top guidelines and NICE guidelines, all written summaries are with you guys. The reason to give that is that you know that what is important, because this is the biggest difficulty in the busy schedule. You people find that you open up a guideline and it takes a day to just pick it up, that what is important, what we have to do and what we have to skip. So for this reason, all the written guidelines are with you guys. You're going to read those written guidelines. Also, when you're busy, you can just open up the video. You're going to, for example, you're just doing your work in kitchen. For example, you're traveling to the hospital. So at that time, when you cannot open up your books, you can just play that. And you just play the video, and all the recommendations would be revised, because all these recommendations updated, I've recorded for the last 10 to 15 days. I've just recorded all the recent guidelines, all the guidelines for you guys, and they're all fresh, updated with important questions in the end, right? Okay. So the written summaries of the Green Top, NICE, and talk article, that's already on your portal in an organized manner. Please do that when you're doing the topic of the day. So these written summaries of the consent advice and the scientific impact papers in the BASH, they're sufficient. Please do not go to the PDF, not at all required. Just go to the summaries of these guidelines. The practice questions you're going to do at the end of the module. Also, after each module, it would be a mini mock test as well. So this mini mock test would be your assessment, but above all, it would be my assessment. So your score is not going to depict what you had been doing. Your score would depict what I had been doing. So please make me proud and work hard for me, because it's going to put me in difficulty if at all you are not scoring well in the mock. That means that somewhere we need to work hard. Somewhere we need to put in more effort, right? So we are going to do self-analysis after each module, and we would see that what needs to be better, where we need to put more attention, Where we are lacking, what are those tiny points we need to work more upon? And we'll definitely do our self-assessment. And each one of you is going to message me that, ma'am, this is the point where I'm facing difficulty, because each one of you is different. Each one of you has different routine, different background, different bases, and of course, different domestic schedules as well. So according to that, you're going to analyze yourself, and you're going to get back to me that, ma'am, here I'm facing difficulty. So here I need more attention. This study schedule from tomorrow, it's starting. And I would strictly tell all of you to do the topic daily, please. If at all, there's some commitment tomorrow. For example, Susan is having duty tomorrow, right? For example, Hera is going to have some birthday party tomorrow. There's some family commitment. So what I suggest all of you is that you have got the schedule, you have to complete the topic earlier. You have to be smart students. It's not that we're not going to put in effort and we'll get the success. It's never like that. You have to put in effort to get successful, right? So if you think that some family commitment is coming, if you think that after 3 days is your call and you won't be able to do that topic, you have to complete that early. Or if not possible early, some untoward emergency, it's there. So you were not planning a break, but the break has happened. So you're going to do that after 1 day. But you have to stay with the schedule. You have to stay with the daily schedule so that you people cover those topics. Otherwise, more it's going to pile up, more it's going to give you stress. So I do not want you all to be stressful at all. The only way is that daily topic, daily. And what do you have to do next day? When you're doing the next day topic, what are you going to do? 5 minutes to the older topic, right? Very well done, Bara. That's my girl. Very well done. 15 minutes to the previous day topic. That's like my girls. Very well done. Great. This is the right technique to pass. And you will remember me. I would be ringing in your ears in exam that this is what I told you. And reproducing those parts would be very easy when you would be sitting in your examination hall. And you remember that, yes, I told you that you have to fight till the last question and you'll make it happen. So mock exams, I've already told you that we'll take it as real exam after each module so that we are very clear about where we stand and are we improving. So the staircase should be escalating. We should be going towards the top of the mountain. And it's not that we are actually not improving, because otherwise you all have paid for the course, or the people who are just going to pay for the course. This should not go wasted. It is a huge responsibility upon me. Okay, you should definitely excel. You should definitely improve yourself as a family, keeping hands in hands together, holding hands. We have to make it a success. No one student, not two student, not three student, but the entire family has to be successful together. All right, all together, you all have to be successful. Okay, so we are going to do self-assessment after these mock exams, and we are going to sit together. So all of you, please, in your paid groups, you've got the date-wise schedule as well. You all can see the date-wise schedule. So these are the sessions. I've not put the dates here because it was an open one. So all the schedule is with you guys. Koshri in the Telegram group. All right, it's already there also in the Facebook, it would be posted. So these are the live session schedule, but the daily schedule has already been posted. It's been around 10 days that you people have it. We are going to get back to you just after this. I'll get back in the study group for you guys. All right, so I'm going to take 2 sessions on gynecology because it's too much. I have to cover the scientific impact papers in that as well. For example, uterine artery embolization, like RCOG paper, everything I have to do. So I've just split it into 2. Subfertility, then urogyne, contraception 1, contraception 2. It's going to be sexual and reproductive health. Yes, Bara, it would be after we complete the module. Bara, after we complete each module, we'll have 1 day, right? Random questions from the same module. Mitri, I'm just going to tell you in a bit, sweetheart. Just in a bit, okay? Sexual and reproductive module, then oncology 1, oncology 2, then it would be surgical skills, the postoperative complications, all fresh, all updated, teaching the clinical cowardice. I'll do the early pregnancy, then we'll come to the obstetrics of antenatal care 1, antenatal care 2, fetal infections, maternal medicine 1, maternal medicine 2, maternal medicine 3, the maternal medicine 4, management of labor 1, management of labor 2, obstetric emergencies, the postpartum problems, bioaesthetics, and then some leftover topics which would be important for exam. I'll gather up at important topics revision 1 and important topics revision 2. Okay, so this would go till November, and you're going to work hard. Sidewise, you're going to revise your other things as well. So what are you going? Thank you very much, Naomi. Thank you, my dear. What are you all going to do from tomorrow? You all have to do the topic discussion in Telegram. The moderator is going to support you in that. I'll be sending the voice notes where you people would be having trouble, but the topic has to be completed. I'll tell you the way we have to do it from tomorrow. The idea of meeting you all today is that you people know that from tomorrow, you'll find a straight ma'am, Sidra, who is looking at you guys that please, you have to study. My coaching is going to be 24/7 with you guys, but I want your support. I just need your motivation. I always tell to my students that I wish I could take exam in your place, but I cannot do that. Exam you have to take, but I'll try to put my brain and transfer all the techniques to you guys so that you people are successful. So after this, topic related questions would be there in the Facebook. So tomorrow questions would be posted there. They're already prepared, so it's going to be there. A book discussion would be in the common group. All right, it's going to be in the common group. All the books discussion would be there, and it's already been done. 2 books are done, and rest is going to be there. Daily you can meet there. Zach is going to post the questions, and daily I receive tags, and then you get my answers as well. And there we are going to correct the books as well. So confusion questions, where you think that the answers are not matching, where you think that you require Sidra, you just can tag, and I'm going to be there to solve those questions daily so that we don't have any ambiguity in daily topic. And after the live session is over, after the topic is over, we are going to do the mock module wise. After that, we are going to assess. We are going to have a tiny Zoom to assess that where we were wrong. What were those things where we had improvement, could have been done? What were those mistakes which were silly? What were those mistakes which we knew the question, but we made a wrong answer? So in this way, daily you people would be improving. The important question discussion in the study group that would keep on going on with the hashtags, which I'm going to explain that further to you guys. So let's get started. Let's do it. The idea to meet you today is to give all the motivation, all my energies to you guys. Again, I would like to tell you that people who had been doing it, they were just like you. And now it's your turn, and you have to make it happen. So this is the MRCOG-2 January 2022 regular course. For all those who were asking, I think in the chat box, Safa has answered them as well. So people, they were waiting because it's the last thing which you people wanted to join just before. It's actually starting from tomorrow, the mini schedule, though my live session is on 11th, but people, they're joining because from tomorrow, it is going to be the daily schedule starting. You have this course for $550, but my moderator had been really kind because she was receiving lots of messages, and she said that, ma'am, please, 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 for me, give gift. And Zach was also there. She was also requesting this. Sorry, there's a question there. Good evening, ma'am. For a first timer, do we have to do questions of the book topic wise? I have no idea about the books at all. Oppo F17. I'm sure you're going to have a lovely name, but this is what appears to me. So all of you, yes, it is going to be topic wise for you guys, right? In the study group, and cover to cover book is also important, right? Cover to cover book is also important. Hira has a question here. One query about joining new course. My 2 friends, they want to join, get any more discount? Yes, Hira, Safa is going to give you. She can give you that coupon for the 2 friends and 3 friends together. Okay, so there are different coupons. Please contact Safa. She's going to help you for that. All right. Okay. Yes, Heba, this is what I'm saying. We are going to update that. Questions are beautiful, but the answers we are going to settle. Heba Abdul Hafiz, my dear, we are going to settle the answer, but questions, they're good quality, so we can't skip them. We'll just correct the questions, answers in the book as well. That you'll make it updated. All right. Okay, Aisha, thank you very much. Okay. So for all those friends who want to join, you're going to go to the RFA Tutors Talent LMS and get the course in $550. But on request of students and on request of my moderators who had been receiving messages, you're going to go to Got a Coupon. When you go to Got a Coupon there, you're going to put RFAGIFT. I repeat, RFAGIFT, and you're going to press validate. It would give you $200 off, and $550 would reduce to $350. but it is for 48 hours for all those who are attending this webinar, who wanted to know about starting the MRCOG Part 2, all those who were waiting that they'll get a gift. So RFAGIFT. So this is what you're going, it is starting just now. Madhavi, sweetheart, starting just now and would end exactly 48 hours, my dear. Okay, so now I'm open to all the questions and answers. Thank you very much. Yes, all talks available. Hala, I have a question after joining the course. When will I get access of all materials? Just 90 minutes, my dear. 60 to 90 minutes, you will have all the website access. Students, they had been studying for like months from the website. Okay, all right. Any other question, please? Thank you, Hala. Any other question? Where are the links of the study group? Ayasala, I'm receiving your messages on the messenger, my dear. I sent you 2 groups, but I'll add you just in a bit again. I know you paid yesterday. Yeah, I know you paid yesterday, my dear. I'll do that, my dear. Kashri, as in I'm new. Yes, it's Kashri. I will do that, sweetheart. Yeah.
I have a question.
Yes, my dear. Who's this?
I just don't know how to use the library because wherever I went, it said incomplete. Will you share your screen to show us how to use the library?
Banu, sure. I'll do that in the study group, my dear.
Okay.
Just after this session, I'll do that and share the screenshots, my dear.
Thank
Okay?
you.
Thank you very much, Banu. I know you're on duty. Thank you very much for joining in and managing to join, sweetheart. Thank you. Okay. Thank you. All right. Okay. So any other question, please? Naomi, Archana, hello, ma'am. What would be the timing for the discussion every day? We'll decide that, Amishi, in the study group just now. We'll just post the time, Amishi. Okay. Thank you, Archana. Thank you very much. Amna Farid, what's the difference between the guided video summaries and the written summaries you do? Written, it's sufficient, Amna. If you're comfortable with the written, it's okay. The video is just in my voice. That's the difference. So at times you can't pick up a book, Amina. So you can just do the video, like putting on the headphones and listening to the video. But if you can read, the summaries are sufficient. And Amna, on your request, I've done that page number thing as well. Amina, did you see? That page number thing is all there now. Is it easy now? Like index and the page number you requested, sweetheart? Yeah? Okay. Thank you very much, Anasfara, my girl. Thank you. Love to know me as well. Our kid. Okay. All the PDF would be there, Geeta, in the study group. Safa has posted already there in their file section. Kashri, in case due to being on duty, we can't attend, what to do? Kashri, if you can't attend live session, though I always suggest students to attend the live session, but if they can't attend the live session, I always suggest that next day go to the recording and get back to me if any questions are there. So recording is going to stay with you till your exam. That's not a problem. Okay. All right. Thank you very much. So Sharania here, ma'am, nice guidelines recording. When will they be available? I've done 10. Rest I'm just going to upload in 2 to 3 days. They would all be available according to the topic. Before maybe schedule, they would be with you. Okay. Right. Nice guidelines notes too. Nasreen, yes, I'm afraid yes. Because next time you won't go to the PDF of the nice. All right, you'll just go to the notes of yours. Facebook study group, the paid group, Premium, Madhavi. If you're not there, Safa, please ensure if Madhavi is in the Telegram, add her into the Facebook group as well. Okay. All right. So from tomorrow, we are going to learn the day's topic. Yes. Yes. Okay, Geeta, the study group on the Facebook. We have got 2 study groups, one on the Telegram and one on the Facebook. So Telegram, we chat and we give the, we talk amongst each other and we do the discussion on the topic. Facebook is going to be for the question discussion. Anytime, Shweta Bansal, anytime, my dear. Koshe, if you're not there, everybody has to join both the study groups, please, the Telegram and the Facebook. Safa is going to write on the Telegram for the Facebook group as well. Okay, that's already there. Nasreen, that's already there. I've recorded there. It's already there. Chronic pelvic pain was one of the first guidelines I did. Yes, because it was a smaller one, so I got energy to record that early. Zoe wants to know about the course duration. It's going to be 4.5 months, starting from 1st of August. It's going to be till mid of November, my dear. And then it's going to be revision. So December and January, then January is the exam. All right, Zoe? So it's long, comprehensive, detailed discussion. Nisha, articles sufficient for exam in the next 4 months? Yes, my dear, that's sufficient, Nisha. This is what I want you to do. All right, pass MRCOG question, Preeti. We are going to cover that in the Telegram group. It would be posted and you all would be doing that. Not required, Anusha. At the moment, not required. We'll guide you on this, okay? Kaushri, there's some issue. I'll try to try again. No problem, Kaushri. You're more than welcome to join. And I have a problem to log in. No worries, Bara. It's going to be settled in the study group. All right. Okay, Anusha, thank you very much. You're very welcome. Any other question, please? Abdullah, Kaushri, thank you. Thank you very much. All right, Mumbai iPad. It's Neha. Book ourselves at the daily topic. Neha, I will tell you that you have to post the questions with the hashtag, and it would just be in the Facebook study group. Thank you very much, Kaushri. You too stay safe, sweetheart. Not required, Sheba, at the moment. At the moment, not required. Okay. All right. Anybody else? No, Sheba, not required at the moment. Thank you very much, Hala. The candidate is waiting for the part 1 result. iPhone. You people can join in, and you people can message on these numbers which are available in front of you. So you all have to start now, or you can join in just after your result. Okay, the day your result comes, it's just like, I think in 1 week's time, right? Okay. All right. Oh, Sheba, I understand. No worries. Either you can join now to begin with, and you can talk to me about the details if at all we have some sort of up and down in the result, or if you want to join on the day of result, you're more than welcome to do that. All right. But this coupon would be active for 48 hours. Yes, it would be done. Sharania, it would be done, my dear, in the Facebook. Yes, Hira, you can do that in the first WhatsApp. You can just drop in a message, and I will add you in the study group. Madhavi, I'm sorry, it won't be available because it has just started now, my dear. Even 2 hours back, students have paid full. So it's just like from now until 48 hours, sweetheart. Okay. In the website after refreshing the page. Okay, Mir, just put this message on the study group. It would be done. All right. Thank you very much, Sheba. You all are my energy and you all are my support. Thank you. Thank you very much, Nithya. In the book, same thing not possible. It's okay, Meena. If the same thing not possible, do it next day, but you have to do it. You have to do it. That's enough, my dear. Ataranam, it's enough, my dear. Definitely, yes, Hiba. Starting from scratch, you can make it happen, but please take a start. Please take a start. I would do that, Aisha. I would do that in the live session. We tell you specifically how to do EMQs, because in each live session, we are going to do exam as well. Real me, please see the schedule. It's 1 or 2 guidelines a day. Thank you very much, Divya. Thank you. Thank you very much. All right. Okay, so I'm receiving messages that you have joined. And if, all those who have joined, please drop in a message on the WhatsApp. You'll be added in the study groups, okay? Right? Thank you very much. Thank you, Mir. You all are lovely students, and you all are going to do that. I'm going to stay besides you till you pass your exam, until you become MRCOG. They are enough, Sheba. They are enough, my dear. They are given for the reason so that you people know that this has to be done. All right? Okay. Okay. Any other question, please? Just read according to your schedule topics, right? Absolutely, Nisha. Nothing up, nothing down. Absolutely strict to the schedule. Thank you very much, Amishi. Thank you very much. They're already in the files section. No problem. Muna, they're going to be done again. That will be fine, Muna. That is sufficient, my dear. Because I'll tell you the Irish differences. You just have to contact me. I'll give you those differences from my notes. Okay, Muna? You just have to follow all this. And I will give you the differences separately of the Irish. And you'll get the access on the website of the differences as well. All right? Thank you very much, Sarah. I'm so grateful. Thank you for these words. Thank you for these this love. Rabia, I gave you strength. Okay, so you have to give me strength as well with the result. Would you? You'll give me the happy result and hard work? Yeah? Okay, thank you very much, Hira. Thank you. All right, friends. Oh, no, Mumbai iPad, please don't get scared. Don't get scared. All right, thank you. All right, friends, so this brings to the end of the tiny chit chat we wanted to do with you guys before you start. If any more questions you people have, you can definitely write. Thank you very much. You people would love the live session, because the things which I'm making now, definitely you're going to feel the difference, and you'll feel that the updated and the recommendations, they're all new. So I'm going to work hard for you guys, but in return, I require hard work from your side as well. Thank you very much, Maitri. Thank you, Sharanya. Thank you, Rabia. Thank you, Hira. Thank you, Preeti Sahu. Thank you, Naomi. All of you, please take very good care of yourself. Best of luck from the entire team of RFA tutors. Your mentor, Sidra, this side. Tiny chit chat. It was just to meet you guys before we formally start. All those who are joining in, thank you very much. See you guys in the study group with all the queries, with all the love, with all the support. Thank you. See you guys soon. Bye-bye from my side. Take very good care. Bye-bye. Thank you.